Assalamu alaikum, hello and welcome to the Health Show here only on the Islam channel with me, Alistair Greener. As you now know, every week we're joined by a health expert within their specialised field who discusses prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, the Health Show offers an alternative viewpoint from the health experts who attend the show to help guide you in the right direction. And if you'd like any further information on our programme or any of the topics that we discuss, then please do get in touch. healthshow@islamchannel.tv. In previous shows in this series, we've looked at stomach cancer and counselling for those who are suffering with cancer. Over the series, we're aiming to look into more types of cancer to help you become more aware of the types of cancer that are out there and also the treatments that are available. Today, we're looking at prostate cancer, which is the second leading cause of cancer deaths in men. We're delighted to welcome Suresh Rambaran, who is a consultant male cancer information nurse at Orchid. And Orchid is a charity based in the UK who work on behalf of anyone affected by male cancer or those who just want to know more about cancers affecting men, be it prostate, testicular or penile cancers. Before we find out more about Orchid, let's introduce our guest. So a very warm welcome to you, Suresh. Thank you.
Thank you for inviting me.
Well, it's great to have you here. We've got lots to talk about today. And Suresh actually has worked for over 30 years in cancer nursing and has extensive experience in cancer information through his work with the NHS, Cancer Backup, Cancer Link, Prostate Cancer UK, Macmillan, and now with Orchid. His area of specialisation is prostate cancer, and Suresh was the first person from the UK's black and ethnic minority community to be appointed as a cancer information specialist. So I'm really looking forward to talking to Suresh about all of that. But before we do that, let's take a look at how Thai doctors are battling cancer caused by a fish dish.
Raw river fish chopped up and mixed with spices. This is goi pla, a beloved dish from Thailand's rural Isan region. The meal is quick, cheap, and tasty, but there's a catch. The fish is often infected with parasites that cause a deadly liver cancer called cholangiocarcinoma. Thailand's northeast now has the most reported cases of the cancer in the world, with up to 20,000 people dying every year.
ก็ไม่รู้เรื่องโรคพยาธิโรคอะไรก็ไม่ค่อยรู้เมื่อก่อนนี้
In the past, we didn't know because we ate the fish and we felt okay. We didn't know about the disease and the worm. But the doctors say that the pond villagers live by contains worms that stay in the fish. A lot of them.
ติดกับแก่งน้ำต้อนนี่มันมีพยาธิพวกอยู่กับปลาเนี่ยเยอะ
The parasite can embed itself in the liver for years, causing inflammation that eventually triggers the aggressive cancer. Most patients die within a year of diagnosis. In order to catch cases early, local doctors and scientists are now organizing mass screenings for villagers who live far from hospitals.
In the Northeast, we have the population about 22 million people, more or less. And the risk patient is about 6 million.
At this recent screening, doctors offered free ultrasounds to 500 villagers. 1/3 were found to have abnormal liver symptoms. Tanin Wangsida was one of the lucky ones.
I don't think I will eat it again, because I wanted to stop eating it anyway, whether the results were good or not. I will cook it instead. That's better.
Health officials are encouraging people to cook goi pla before eating it, in order to kill the parasite. But changing eating habits is no easy task in a region where culinary traditions have been passed down for generations.
So Suresh, it was really interesting watching that programme because one of the things that we've been talking a lot on the Health Show throughout this series and the previous series is about what we eat making a difference to our health. What do you make of that particular report that there's a parasite in certain fish that can cause disease?
Well, that surely could be true from what I've seen, because I know, for example, in Egypt, they have high incidence of bladder cancer. And that's because Egypt, when they go in the lagoons and the water, a parasite goes up in their feet and end up in their bladder and causes bladder cancer. And that's one of the reasons Egypt have one of the highest incidence of bladder cancer in the world.
So really knowledge is key here if you're aware of what causes it. So we're talking specifically about prostate cancer today. So let's start off with that. First of all, what exactly is prostate cancer?
Well, there are 200 different types of cancer. Prostate cancer is just one of those. And as we know, it's the highest cancer in men in Western society. It's in the UK, 47,000 men are diagnosed annually. We have 350,000 men living with prostate cancer, and every year 11,000 men die from prostate cancer. Where the prostate lies, it's a small gland, sits below the bladder, surrounds the water pipe, and this can get cancerous.
And is there anything that typically causes this cancer?
We don't know the cause of prostate cancer, but we know the risk factors. So older you get, higher risk. 80% of men who are diagnosed with prostate cancer will be 60 years and over. So age is a factor. So, a lot of men in their 80s who die in their 80s, and on post-mortem you will find they had prostate cancer and unaware of it.
I was going to say, I've heard that phrase of more men dying with it than of it.
Yes, well, we say that because they don't unaware of it, or if you're diagnosed with it and you look at life expectancy, we'd say you're more likely to die of a heart attack or some other condition rather than the prostate cancer.
So
generally, it's a slow-growing cancer.
So although it's really, really serious, it's not as, what would I guess the way to say?
It's lung cancer or bowel cancer. It's not as serious.
So it's not quite so aggressive.
No, exactly. Right. So it's not a killer disease. Having said that, there are some aggressive forms of it, and therefore the cause of the reason for awareness is people to know early so they can go and get checked.
Okay, well, first of all, let's talk about the screening process. Who can go for screening? Is there an age when that screening starts? And what actually happens?
Well, there's no screening process for prostate cancer, and that's because we don't have a test that is 100% reliable. The test that they do is a blood test. It's called the PSA, which stands for prostate specific antigen. It's a protein that's released by the prostate gland and present in the blood. But it can go up with prostate cancer, but other things can make it go up. For example, an enlarged prostate, which is a more common problem to affect us men. You can have an infection, or you can have a prostate infection. All these can make it go up. Vigorous exercise, ejaculation prior to the test. Therefore, the government don't have a screening test, and in most countries in the world. But what we do have in the NHS is something called the Prostate Risk Management Program. And any man 50 years and over can go to their GP and say, I want a prostate check. And when he tell his GP that, the GP tells him the pros and cons, like I'm saying, it's not 100% reliable. And the GP will, if the patient wants it, he can have the blood test, and also he will do a rectal examination to feel the size of the prostate or feel if there's anything abnormal in prostate. But most GPs don't do that. They do the blood test. Some GPs sadly do not know or are aware of the program, the prostate risk management program, and turn the patient away. It's the patient's right to have that test if they want it. And
so your advice is basically to all men, ask for it.
Yes, and I would say use this as a baseline. So if you have your test at age 50, you go back at 51 and 52 to check it, say annually, you can see if there's any trend in the PSA levels, which can indicate something is wrong. So it's important, but we talked about risk factors. I didn't say the other two important risk factors, and one is ethnicity. And while 1 in 8 men will develop prostate cancer in the UK, among black men, black African and black Caribbean, 1 in 4 will develop prostate cancer.
And is there any reason for that, or just one of those genetic things?
I would say it's genetic, although we don't know 100% conclusively. But if you look at the incidence of prostate cancer among Black American, Black Caribbean, the incidence is high. And we see a similar pattern among West African and also other African nations, but mainly West African. And if you know the history of West African and the slave trade, they were taken from West Africa to these countries, and you can see the genetic link with prostate cancer there.
And how, you said that the screening itself isn't foolproof, but what sort of results are coming through as a result of that screening?
Well, you know, more people are going to, because of awareness, going to get checked, and we're picking up more cancers. It doesn't mean always they will have to have treatment. There's a thing called active surveillance where they can observe it, provided they catch it very early. And every 3 months they observe you. It may come a stage, 5 years down the line, the doctor will say, well, your PSA has gone up, we think we should give you radical treatment or treatment now.
And we'll come to treatment in a little while. But so people who do get screened, people who do go for this test, a lot of people are picked up at that stage. And obviously, like with any cancer, if you pick it up at the early stages, your prognosis is obviously a lot better. Other men, of course, the first thing they will know is they will start having symptoms, and then they will go to their doctor, and then they'll have a check and it'll be discovered. So what are the typical symptoms that a man will observe in himself that would give him indication he should go and get himself checked out?
Well, firstly, before we go to symptoms, I just want to reiterate that a lot of men, at least 25% of men will have no symptoms. Therefore, it's important they go and get checked. And the most common symptoms are what we call lower urinary tract symptoms, LUTs, which is frequently passing urine, particularly at night time. You're going to the toilet. When you go to the toilet, sometimes you need to rush. You're not completely emptying your bladder. So those are the most common one. Less common symptoms is erectile problems, blood in the sperm or urine, and pain in the bone. But then I have to say to people, if you have these symptoms, do go and get a check. You know, one of the fortunate things in the UK, we have a health system that is free. You're not wasting your doctor time. If you have symptoms, you should go and get a check. It don't mean you have cancer necessarily, because the most common prostate problem is something called an enlarged prostate. And as we men, when we hit age 50, there's a change in our testosterone levels within the prostate, and that makes it become enlarged. It's a non-cancerous condition and give rise to the same urinary symptoms. You can get problem with your bladder, kidney, or even diabetes could make you go to toilet regularly. But these symptoms are abnormal, and therefore it's important to go to your doctor and get checked.
And that's the issue really that we keep on saying on the show, is that regardless any part of your body, if something's a little bit different to normal, then absolutely go and get it checked, because we, and especially men, let's be honest, they're a little reluctant to go to the doctor, and especially when that part of the body where it's a little bit more, they're just that much more wear and feel, maybe a potential embarrassment or something. But the message is absolutely anything different, go and get checked.
Exactly, and you're quite right. Us men need to be more proactive and take responsibility for our health. Sadly, among our BME community, we have a taboo about cancer, and we don't want to know. We bury our head in the sand. And it's important that we go to our doctor when we have symptoms and get checked, because if we catch it early, you can have curative treatment. Often, a small percentage of men, the cancer is not caught early, and we cannot give them curative treatment. And the idea is to men to get your symptoms checked, so if we find it early, we can offer curative treatment.
And as you say, we often find within the BME community, and particularly within the Muslim community, again, so often a reluctance to go and get help from the professionals, from people who actually understand these issues.
Yes, and I say that to our people. It's very important. We're fortunate to live in a country that has a very good health care system, minus its few faults. But we're fortunate. People look at America and think America have the best healthcare system in the world, but they have no idea. If you don't have insurance, you don't get the treatment as we do. So we're here. It's for you. You work, you pay your taxes. Please be proactive. Take responsibility for your health. Cancer is not infectious. It's nothing to be embarrassed about. Go to your doctor and get checked.
And of course, the big message with cancers today is there's more hope than there's ever been before, that if you catch it early enough, you could actually have a positive outcome.
Certainly. And for example, with testicular cancer, which we mentioned, one of the men cancer, 98% of men who is now diagnosed with testicular cancer can be cured. 98%.
That's very positive indeed.
Yeah. And with prostate cancer, 80% of men will go into remission if we catch it early and or give them radical curative treatment.
What about prevention? You said earlier on that there's no evidence to indicate any particular cause for prostate cancer, but is there any evidence or research to talk about certain foods or certain lifestyle aspects that might affect your chances of developing it?
Yeah, certainly. But just two things I want to say with risk factor. The other one was family history. If you have a father, brother who had prostate cancer, or grandfather, particularly at an early age, you are 2.5 times more likely to develop prostate cancer. So that's a risk factor, and that's why you should go. If you have a mom, sister, or someone who had breast cancer and had a BRCA gene 1 or BRCA gene 2 that was abnormal, then that increases your risk. The other possible risk factor is a westernized diet. As said earlier, the highest incidence of prostate cancer is in the Western countries, and that's perhaps attributed to our diet. We eat a diet high in saturated fat, high in dairy product, a lot of processed food, red meat, and these may contribute to it. I cannot say 100%, but these may contribute. A recent study suggests that being overweight, and against that due to diet, is causing more aggressive prostate cancer. So one should eat a healthy diet and live a healthy lifestyle.
And what about exercise?
Well, certainly exercise. And the government now have a program where they're advising people they should try and have 30 minutes of exercise. Not necessarily going in a gym, but going for a brisk walk every day. And as I say, eating a healthy diet. Look at your diet. We all enjoy things from time to time, but you do things in moderation. Eat certain food in moderation, but stick to a healthy diet.
And if we were to try and pinpoint exactly what causes these cancers, is the jury still out, or do we think there's a certain percentage which is down to lifestyle, down to hereditary factors or whatever? How would you divide them up in terms of what we think the likely cause is?
Well, it's so many, as I said, different types of cancer. For example, we know lung cancer can be caused by smoking. We've seen that clip about in Thailand. Stomach cancer is very common in Japan, and we think that's due to their diet. In China, nasopharyngeal cancer is more common among Chinese people, and they think that is due to a virus. Certain parts of Africa, there's hepatitis B that can cause liver cancer. So different parts of the world, and among the Asian community, one of the things is the smoking pan and all of that can cause cancer, and that's another risk factors, and we are trying to educate our community. Be aware of these things. It can increases your risk of developing cancer.
And again, we talked earlier on, you said that there's certain BAME communities who are more susceptible to this. Do you think that those who are more susceptible, could it be down to the diet, the types of food which are traditionally eaten by people from that community?
Well, the jury is out. It may be in some countries, yes. But we need to see the types of cancer. Further, where among the Asian community, it's not so much the diet causes the cancer. It may cause other health problems, diabetes and heart problems. But we do know the smoking do affect them, causing mouth cancer and throat cancer.
I want to come now to the treatment of prostate cancer. And again, I think there'll be very, very few people watching this who will not have encountered somebody who has suffered from it at one stage or another in their life. And funny enough, just before we came on air, we were looking at, some of the celebrities who've really raised the profile of prostate cancer. People like Sir Roger Moore, who died earlier on this year, although he didn't die of prostate cancer, but he had the cancer. It is very, very high profile, but we also hear about the different symptoms and how many different ways of treating this cancer there are. Maybe you could just highlight one or two of them, and certainly maybe those early stages. You said earlier on about sometimes actually if the PSA level is quite low, that actually they can just sit and watch it for a while.
Yeah, well, let me explain. When we say someone is diagnosed with cancer or the PSA is abnormal, the next thing they will do a biopsy, and the biopsy will confirm whether it's cancer or not. Now, if it's cancer, then they will go on to have an MRI scan to see if it's spread elsewhere. If it hasn't spread, then the cancer is what we call grade and stage. Grading says how aggressive it is, and stage is if the cancer is spread. If it's grade 1 or stage 1, I should say, you can have 5 different possible curative treatment.
Wow.
One being active surveillance. Now, and the other one is a robotic surgery where the surgeon is sitting in a console operating at the patient over there. That is common now in England. There are about 25 of those robotic
And is that
machines.
done through like a keyhole
Yes,
process?
keyhole
Yeah.
with the robot. Then there's radiotherapy, 2 types. One we call external beam, which is like an X-ray, which you have to go for 7 weeks, Monday to Friday. Another one is inserting radioactive iodine, radioactive seeds directly into the prostate under anesthetic. There's something called HIFU, high intensity focused ultrasound, which they can use as well. So we have all these treatments for early stage of prostate cancer. Stage 2, your treatment option drops to about 2 or 3, surgery and radiotherapy, maybe another treatment, but as it goes there. But if you go to stage 3, then your treatment options drop again, and it may be only hormone treatment.
And what exactly would hormone treatment involve?
Well, glad you asked, because prostate cancer feeds on testosterone. And what they do is they stop the man from producing testosterone by giving him an injection. And by not producing testosterone, you're starving the cancer of that food, and the cancer cell die.
So a very logical way of doing that. Now, what about patients who sadly haven't discovered they've got prostate cancer until a much later stage? You were saying there that probably the only alternative there is this hormone treatment or surgery. What would the surgery typically entail?
No, there wasn't surgery at a late stage.
No, okay.
It only at the early stage. The option there is only the hormone treatment. And previously, years ago, before medication came out, they used to remove the testes. Now we don't remove the testes anymore. They give you an injection which tells the brain to tell the testicles not to produce testosterone, and he stopped. And we can control the cancer for many, many, many years. 5, 10 years with that, depending how aggressive.
We've got lots more to talk about, and certainly I want to talk about Orchid as well, and the care and the support that you offer. But we're already up to the break time, so thank you very much indeed for the moment. What we should say, again, as always, we must stress that should you suffer from any medical problems whatsoever or have any health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show offers an alternative viewpoint to the health concern that we've been discussing. As I mentioned, it's now time for a short break, but don't go away, because when we come back, we'll be talking more with Suresh about the support available for those suffering from any type of male cancer. See you soon. Hello and welcome back to The Health Show, where our topic today is prostate cancer. We've been joined by Suresh, who is a consultant male cancer nurse who has so far given us a great insight into his work. We'll shortly be talking about his charity, which supports those with cancer. Relative survival statistics compare the survival rates of patients diagnosed with cancer with the survival rates of those people in the general population who haven't been diagnosed with cancer but are the same age, race and sex. Now, although survival rate statistics are based on large groups of people, they still can't be used to predict exactly what will happen to an individual patient. No two patients are entirely alike, and treatment and the responses to treatment can vary greatly. We're now going to hear from patients who have been diagnosed and to hear how they've coped.
If you've just been diagnosed, it's really hard because you've got lots of thoughts going through your head. First thing, why me? And my view, well, someone's got to get it, and it was me. But it's you've got to be, well, you've got to try and be positive. I think that will come through. Hopefully it will just be a couple of months, then maybe a couple of months to get your fitness back, and you can carry on where you left off.
I think probably the best advice for any man going through testicular cancer treatment is to open up and talk to your family and friends. Try and plan around your treatment and involve as many people as possible.
I think it's a bit about understanding yourself, being aware of what it is that you feel, being aware of how you relate to other people, maybe reflecting a bit on your life, thinking about the things that you really enjoy and that kind of give you a lot, thinking about the things that also might be quite difficult or that challenge you, and allowing yourself a bit of space to feel those things actually, and also being willing to kind of work against that idea of put on a brave face, bury your head in the sand, those kind of really traditional ideas about what men are supposed to do, and actually think about it more as I'm going to have the courage to address a problem, to acknowledge a problem if there is one, and to try and do something about it actually.
I mean, I was 32, I was married, I had 2 sons, so it was probably a lot easier to accept because I've already done the manly thing and I'm bred. But I think if you'd have been younger, say 16, 18, it's probably a hell of a lot harder to handle emotionally because maybe you've got no one to speak to. It's not the sort of thing maybe you want to talk to your parents or your mum around, and it's not something you're really going to discuss with your mates at school or college or university or even the workplace or wherever. So you might feel more isolated the younger you are, and I think that's one of the big problems, especially for the younger person, is to deal with it. And they're thinking, well, as a girl want to be with me, I'm not a man anymore, and there's all that side.
I think I broke down. Well, no, I know I broke down. I guess I was incredibly upset. I was standing on the street just wondering what to do with my life. Or not wondering what to do with my life, but I was worried about things automatically. I think everything had been so rosy up until that point, and life had been pretty good, and I was young and healthy. And then I realised I had a serious health issue, and I was worried about how far it spread. So I guess I stood on the street for probably maybe an hour or two before I called anyone. And I eventually called my brother, actually, first.
Naturally, being diagnosed with testicular cancer means there's probably a range of people around you who are affected, actually. They may be family members or partners or close friends. In terms of advice for those people, I think sometimes people can get caught up in a cycle where both parts, the person who's diagnosed or being treated and the kind of loved one, are both trying to protect the other actually by not talking about it, by putting on a brave face, by pretending to be strong, pretending in some ways not to be affected by what's going on. Whereas probably at some level both know, well, this is affecting both sides. So the patient themselves may well be saying, well, I need to pretend that everything is okay, I need to pretend to be strong because I don't want to worry my kind of loved ones, and again the loved ones are feeling, well, perhaps I don't really have a right to feel troubled by this because it's not affecting me, directly, personally. Perhaps I need to pretend again also that I'm okay, that I'm fine, so as not to worry the person themselves. And I think in some ways both of those things can be quite unhelpful at some level. So I would encourage both sides to try and find a way to talk to each other a bit about what's happening and to be honest with each other, to try and share this experience in some way, and also to try and find other people to speak to.
Now, Suresh, it was fascinating watching that video, because the big thing that comes out of that is that although the person being diagnosed is directly affected, it's actually affecting the wider family as well. Is this something that you tackle when you get people coming through your doors at Orchid to actually help people as a family deal with this situation?
Yes, often one of the things is that people, when they're diagnosed with cancer, some people would not talk to family members about it. They think they're trying to protect them by not talking about it. And we encourage people to talk about your cancer because you can support each other. They're there for you. You cannot hide it for them because sometimes they suspect something is wrong and there's a bit of worrying. So it's important to talk about it. I know, as I say, among the BME community, we have a taboo about cancer and don't want to talk about it. But we need to, it's not infectious, you're not doing something wrong. So it's something to be open and frank about. When you share that about your cancer, it lets out some emotion and help you to cope better, and I think it's important to talk about it. And we at Orchid, we provide a helpline where you can speak with a nurse confidentially who can talk to you about any concerns you have about treatment. We will follow it up with printed material if you need.
And that's the real key, isn't it? Knowing there's an independent health line, somebody who maybe you're not ready to talk to the family yet, despite all the advice that's given. Actually, to know there's someone like Orchid there is really, really helpful. And it's specifically for men as well. So you've heard this all before.
Well, it's not specifically for men. Women phone us as well because their partner, they suspect and they don't know the full story and they want to know a bit more information. So we also have ladies, friends, family who will phone and ask for information. Yes, men can call. There's something, when we get a diagnosis of cancer, we sit with the doctor. The doctor may tell us things we wouldn't have taken it all in. We may forget, or we would want to ask a question we wouldn't have asked it. You can call us, talk to us, ask us a question, and we may be able to provide that answer for you. So that's what we have this helpline for.
And I like the fact, like we saw in the video there, that there's help and guidance for people, as you quite rightly just said, who are maybe, a part of the family. They've noticed something with their loved one, something's not quite right, and they're wondering how to tackle it. And because you'll have heard that situation from so many other people along the way, you know exactly what to say and how to guide people.
Exactly. And, we said this is not uncommon for people, but talk to them, go with them, support them, go to the doctors, send them some printed information as well. Particularly with prostate cancer, one of the common problems, as I said, is the urinary tract symptom, going to the toilet, particularly at night time. They disturb their wife. The wife gets fed up sometimes and said, look, you have to go to the doctor now. Ignoring it is not going to make it go away. You need to attend the doctor and get it checked out. Don't necessarily mean you're going to check for cancer, but something is wrong. And it's important that you go to your doctor and get checked.
And I think, again, especially for men who are somewhat reluctant, shall we say, to go to the doctor and to talk about particularly personal issues such as this, that actually by doing that, you're not going to be wasting their or your time. Doctors know who the time wasters are, the people who keep on coming for everything, and then all of a sudden you haven't been there for some time, you've noticed something wrong, they'll take you seriously, won't they?
Exactly. And doctors are doing this examination all the time. One of the things about us men, we do not like to have a rectal examination, and if we feel embarrassed. But doctors doing this 24/7 all the time. Don't be embarrassed. You know, it's nothing to them. It's done in the privacy of a room. If, you know, is a female doctor and you want a male doctor, you will get a male doctor to do it for you. But, you know, the vital thing is that you go to your doctor with the symptoms. As I say, they will do this blood test as well. Not always. They will have to do the rectal examination at some stage if it's abnormal. But you would find if you go for a routine check, they don't always do the rectal examination, although they should do. But men really should go and get a check. And especially, I said to a BME community, we're fortunate to have a health service that offer these facilities for us, and we should make good use of it. We have very good charities such as Orchid, who is out there to support you before and after diagnosis.
I was going to say with Orchid, just before we move on to talk about the profession that you're in a bit more, what are the other sort of things? You talked about the helpline there that Orchid provide. What else does the charity do to support people?
When the charity first started many years ago at St. Bartholomew Hospital, the aim was to fund research into cancer treatment for testicular cancer at the time. And Orchid started like that, raising money to do research. We still fund research into cancer, male cancer, I should say. We concentrate on male cancer, so we fund research into that. We also do an awareness program. Currently, Orchid is doing 5 London boroughs, raising awareness among Black African and Black Caribbean men who is at high risk, and this is funded by the big lottery. So we go around. But we don't, you know, through the general community, anyone wanted Orchid nurse to come and give a talk and awareness to your community, we're happy to come along and do that.
And that's great to hear. And again, raising that awareness, because we are getting better at it. We should be positive about this. We are getting better about going to see the doctor and so on. What other patterns have you noticed as a nurse specialising in this area? What are the other trends that you've noticed so far, and where do you think we're going to be seeing this in the future?
Well, I think, you know, one of the things we hope we get a more accurate test for prostate cancer, and with some other type of cancer as well. But awareness is being raised. You know, when I started in this job many years ago, I used to say 23,000 men are diagnosed with prostate cancer. Now I'm saying 47,000 men. And that's not because more men is getting the cancer. That is two things, because of awareness and we live in longer. So older we get, higher risk. And, you know, men going and getting checked early, so we're picking up more cancers.
And it's good to put that into perspective, because those are UK figures alone, right?
Yes. You know, the UK figures, yeah.
And it is interesting to see how that's all changing and so on. In your job as a nurse, first of all, what made you specialise in that particular area? And tell me a little bit more about how your work sort of led to that specific area and what you actually did.
Well, firstly, you know, I trained as a general nurse, and I went to the Royal Marsden Hospital, which is the most famous cancer hospital in the UK, where I did my cancer training. And I took it from there and got involved in cancer information and giving out cancer information on helpline, talking to people. But being from a BME community, I have an interest in raising awareness because there's a low uptake of screening among BME people, a low awareness of cancer and this taboo. And I'm trying to break this taboo and get our people to come forward and go and get checked. And I've been campaigning.
And especially as they are a community who are particularly vulnerable.
Yes. And, you know, I've been doing that, and my passion to go around and talking about them. And I connect with them because, you know, sometimes I went to Manchester to give a talk, and this Middle Eastern guy come and speak to me and said he's on prostate cancer and on active surveillance. This is where they're observing. And he called me about 6 weeks ago. The doctor said my cancer is getting active again and you should have treatment. So he wanted to talk to me about it. And this is not on the helpline. This is just outside the thing because he took my personal number. So I do give people my number if I go to give a talk, although I don't want to say, well, just ring the helpline, you know. Sometimes they connect with me, and, you know, many times people will ring me to ask for my advice. I would say I provide information and support rather than advice, because I wouldn't tell them what to do, but I'll discuss the pros and cons of the different types of treatment and which, you know, they should choose from.
And that's really, really important for people to know that A, the advice is there, but also to actually listen to that advice as well. Because one of the things you were saying earlier on was that the success rate of treating people with prostate cancer has increased immeasurably.
It has, you know, as I say, we can say over 80% of men who are diagnosed with early stage 1 prostate cancer can be cured. So, you know, that is a very good thing. Prostate cancer is one of the few cancers that when they find it, they can observe it for many years without giving you radical treatment.
Now, we talked, the video obviously was talking about a younger age, which I think was more probably towards testicular cancer.
Yeah, it was.
But the prostate cancer, what's the earliest age? You were saying typically in 60s and after that, but can it happen earlier?
Yes. We know in some men it can occur in the 40s. And what I say to black men, particularly this applies to black men, you know, I said the prostate risk management program say 50 years and over. I advise black men to go at age 45 because they have a higher risk. They tend to get it 5 years earlier, and this is from American research, and therefore black men should go earlier. But under the age of 40, out of the 47,000 are diagnosed, only about 20 is under the age of 40. That could tell you how rare it is. It's not a young man disease. You could say that of testicular cancer, which will affect men between the age 15 to about 40, which is testicular cancer. 2,500 are diagnosed annually. So that's a more younger man disease. Prostate cancer is an older man disease.
And again, that obviously, therefore, you become more aware. And obviously, for younger men, you know, it's all, again, still this thing of anything being a little bit different to what you're used to is to do something about it. Now, I want to talk a little bit now about people living with people who may have the symptoms of prostate cancer. What would your advice be to them? What should they be looking out for, and what should they do?
Well, firstly, if they go into the toilet frequently, particularly at night time, if they need to rush to the toilet, they say the bladder is not completely empty, the urine flow is weak, if they're suffering from erectile problems or blood or sperm in the urine, or even the bone pain, they should get them to go to the doctor and get a check. It doesn't necessarily mean cancer. If something is wrong and it needs to be investigated, but don't sit on it and ignore it. It doesn't go away. It's important to go and get checked. And I know a lot of ladies from there pushing their partners to go and get checked. Turned out a lot of these men sadly had prostate cancer, and that is because their wives got them to go to the doctor and get checked.
And which happens very often indeed, doesn't it?
Yes.
And again, we can't stress enough this whole thing of if you get in there early enough, as soon as you get any indication, don't put it off, don't procrastinate, just go and get yourself looked at. And who's your first port of call? Would it be to just contact your GP?
Yes.
And will they then send you to a specialist, or how does that all work?
Well, you go to your GP, and what your GP will do is the blood test, the PSA. You may do a rectal examination. It will test your urine for infection, send off a specimen. If these are abnormal, you are referred to a urologist who is a specialist at the hospital. And under the NHS guidelines, you will be seen within 2 weeks. Wow. The urologist may repeat the same test again, and based on that, then they will do a biopsy. And that is the only conclusive way you can tell if someone has cancer.
And how invasive is the biopsy procedure?
Well, the biopsy is, and because the PSA wasn't 100% accurate, a lot of men was having unnecessary biopsy based on the PSA. Thankfully, in the last 3 years or so, we have a new imaging called multiparametric MRI imaging, where now if something is abnormal of the prostate, before the biopsy, they do a scan. So many people, if your doctor is going to biopsy, you ask for the MRI scan prior to the biopsy. So if they do the MRI scan, they see something abnormal, they will biopsy that area. If they don't see anything abnormal, then you don't have a biopsy, so you avoid a biopsy, and it's unlikely you have cancer anyway.
And you talked earlier on the survival rate's been so great. What's some of the best stories you've heard where people have maybe got their diagnosis really early, they've been observed and then treated and so on? You know, what sort of success stories are there out there where people have actually gone on to live very healthy and fulfilling lives?
Well, there are many, you know, and because I concentrate on the black community, I don't, but they are in the white community as well, and I don't want to dismiss that. But you know, people like Colonel Powell, who is in America, Linton Kwesi Johnson, a famous reggae artist. I was saying the black Muslim leader in America, whose name Louis Farrakhan, I cannot pronounce it properly. He has prostate cancer. The Archbishop of York, he's got prostate cancer, and they're all well up and about and doing well. And they're prime example, and there are many, many more out there who are alive and well.
And I think there is that hope, isn't it, when you hear about Ben Stiller and Robert De Niro and so many people, you know, just as women are coming out and telling women to go and get themselves checked for breast cancer, just for men, it's just important, but actually maybe even more so because, of course, men have that reluctance to go and see their doctor in the first place. Yeah,
exactly. We men, sadly, we have this thing about we stoic, masculine feeling. We don't want to go to doctor. Women are more good. They go for the cervical screening. They go for the breast screening. Us men, we don't go.
So the message is to everybody, go and get yourself checked. And ladies, if they're not going, make sure you push them to do so. Thank you very much indeed.
Thank you for having me.
Thank you. Unfortunately, that is all time we have for this particular week. I'd like to thank Suresh Rambaran, our consultant male cancer information nurse today from Orchids Charity, for giving us such a vital insight to this subject and essential guidance on how we can all help to fight cancer together. If you're suffering with any form of cancer or know anyone who is, please do remember that you're not alone and support is available to you. So just pick up the phone and get in touch. Once again, we must stress that should you suffer from any medical problems or health concerns, it is always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern that we've been discussing. If you'd like to find out more about this particular subject or any of the subjects we've discussed on this show or any of our shows, please do email us at healthshow@islamchannel.tv. But for now, it's goodbye from me and see you again next time. Assalamu alaikum.